So we switch now to Ask the Expert. More than 48,000 people in the U.S. will be diagnosed with oral cancer this year alone.
And that breaks down to 132 people a day. We have Dr. Martin Korsten from the Aurora Healthcare, and he joins us now live this afternoon. Let's start with the basic. What is oral cancer?
Oral cancer is cancer of the oral cavity, which is the front part of the tongue, the lips, the floor, mouth, and the cheeks, and also the oral pharynx, which is the tonsils and the base of the tongue, the back part of the tongue.
Is there any one group population that is most at risk for oral cancer?
So for years, oral cancer was basically just caused by tobacco, so smoking or smokeless tobacco consumption. But over the last 10 to 15 years, there's been a dramatic increase in the numbers of these cancers caused by a virus, the human papillomavirus, the same virus that causes cervical cancer.
So why? I mean, you're seeing it in large numbers?
Yeah, the incidence of especially tonsil and base of tongue cancer is going up by about 3% per year, so about a 30% increase over a decade, just because of the increased prevalence of this virus.
Is there any way to protect oneself from HPV and then it leading to oral cancer?
Sure. So the vaccine that kids get usually around grade 8 for that was originally started for cervical cancer will work just as well for oral cancer. It's the same strains of HPV. It's 16 and 18 that cause cervical cancer that also cause oral cancer.
So when you look at treatment options, are there many?
Yes. The treatment of oral cancer is complex, and usually what I describe it's a team sport. So these patients can undergo surgery, radiation therapy, or these days we sometimes add chemotherapy to the radiation therapy to enhance the effect.
How successful is that from it not reoccurring?
It depends. So if these tumors are detected early enough, we have extremely high cure rates, often 85–90%. And you would think they would be detected early, given that it's something that you can see in the mouth or feel. Sadly, we still do see a lot of patients who present with advanced disease, and the cure rates for that might be a little lower, like 50 or 60%.
Which goes to the point of trying to get you to your dentist at least once or twice a year, because if there's something going on, they can initially see it.
Couldn't agree more. First of all, the rate of developing these cancers is higher if you have poor dentition, like cavities and inflammation.
Really?
But more to the point, the dentists do a great job of investigating and examining the entire oral cavity. So we get sent a lot of patients from dentists, and I would say that preventative-wise, that the most important thing you could do is go see your dentist once or twice a year and get a good oral exam.
Wow, well, thank you.
Good information. Thank you for coming in and sharing that with us. If you have a question for our experts, email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. We'll be right back.